If your buddy doesn't get it down, what are you gonna do?
Get back.
We're gonna hustle our butt back and we're gonna get back to third, okay? And I won't have much of a voice left because I'm gonna be screaming too much, right? All right?
Big scrimmage on Saturday. Be the first game of the year.
Yep. But they've been playing together for 3 years now, for the most part.
We are going to give you tons of high fives if you get out there, but we score that run. Because we're gonna do this when it's a tight game. Maybe it's a tie game, or maybe we need that one run. We're gonna roll the dice. We're gonna try to take our chances, and we'll take the out in order to get the tie or get the go-ahead run. Okay?
I remember walking in the door and seeing my kids, looking at them thinking, whew, what kind of a roller coaster ride are we gonna go on? And I remember holding the kids so tight. Both kids asked, are you gonna be at my sporting events? Are you gonna be at baseball in the spring? You know, are you gonna feel well enough to do those things? And as a mom, you really want to protect your family. I remember laying on the exam table. What I could see was a solid mass on the ultrasound, and so I knew we weren't up against a cyst. Based on the characteristics of the ultrasound, it looked like it was something more. I was definitely worried that this was breast cancer, and I had a 15-minute drive home, and I cried that whole drive home. This is one of those times when they ask you, is it easier to be in healthcare or not? And this was probably one of those moments where it necessarily wasn't. Because you know that something's not right, but you don't know how bad.
Boy, you don't walk slower into a room than when you know you're going to bestow a diagnosis that will impact not only the person in front of you, but they're going to immediately think about how it impacts all the interconnections that they have in their life. We had a patient one time who told us that when she got her diagnosis of cancer, and it was of a breast cancer at a young age, she said it was like somebody threw a 1,000-piece puzzle on the floor. And she didn't know where she would go with that. So she's got all these puzzle pieces on the floor. And, you know, it was also overlaid by the fact that her mother had and died of breast cancer. So she's got that background as well. And she said her mother's route was a difficult one. Care was fragmented, nobody knew her story, everybody was doing a piece of the care here. And she was fortunate enough to have an experience here that was quite different.
When I started out, when I first finished my fellowship, I thought, you know, surgery is the center of the universe for everything that goes on in a pancreas cancer patient's life. And the surgery is the crucial episode of their care, and what happens before is probably important. I didn't really understand it or pay attention to it. What happened after, likewise, and I very quickly learned that, man, that's just absolutely wrong. Everything that happens before and everything that happens after is almost certainly more important. My episode of care, doing an operation and caring for somebody after the operation, is vitally important. It's the only potentially curative treatment for pancreatic cancer. But man, it's a small slice of what happens in an individual's life. I think that's what makes our organization unique, is because those things are important and we do realize they're important. And we do commit to each of those interactions, I hope, in a special way every time.
Healthcare becomes very personal very quickly, and you start thinking about yourself or your family member or a friend or loved one, and you can pretty quickly think of an experience that didn't go all that well, and you think, okay, well, we have pockets of excellence, we can do better. And so we scripted some of those talking points, and then we started with all of our meetings having a patient actually come and talk to us about their story. It's a really tough thing to do. You start to have those stories available for people to hear and respond to, and then you go back and say, well, I can keep doing it this way, or, change starts with me at all levels of the organization. And so as a team, we need to be able to be clear and execute and hold ourselves accountable to what the key outcomes are that we want to drive towards.
My name is Nicholas Fulton Fisher, and I am a senior recruiter for a local IT consulting firm, and that has been very good to me. I was 25, was in a motorcycle accident. I had a big cruiser, an old man's bike, if you will. It was raining, and probably only going about 35 miles an hour. And basically someone tried to get over and got cut off and just avoided being hit and kind of started sliding, and then the weight of about a 1,000-pound motorcycle just snapped down to the ground. Well, I remember getting on my motorcycle and wiping the rain off of it at the grocery store before getting on the highway. From then on till probably 3 days after, I have nothing and have never once even had a flashback. I woke up as a patient and could pretty quickly determine kind of what had happened, even though I missed a handful of days in there, and basically just said, all right, what's next?
Good morning.
How are you?
Good, how are you doing?
I'm doing well.
Good to see you again.
Good to see you.
All right, well, we're gonna...
We off?
Yeah.
Okay.
Are you already registered?
Yeah. Alina, I would say, does a phenomenal job in terms of really asking patients kind of what they want, what they experienced that was good, what they experienced that wasn't good, taking, detailed notes, and then going and making, system-wide changes or creating initiatives, doing things based on that feedback.
This is Nick Fulton Fisher. He has been an advisor at Alina Health for a few years, multiple capacities. He's been on the Alina Wide. We just are so glad to have him participate in our partnership program, and so he's here to say a little bit about his experience.
So I'm a T11 para, and my kind of journey started with Alina in June at Courage Clinic here at Abbott.
I think if you look at the history of healthcare, this industry has been very fragmented, and the patient has had to kind of figure it out themselves, and you bounce from this physician to that physician and into this hospital and back out and maybe into a different hospital the next time. And there's no one sort of looking at your journey in total except for you, the patient. That's a big burden to place on a patient to figure us out. So our clinical service lines are organized to be that solution, where if you come to us, we'll guide you on your journey, wherever that happens to take you.
Switch it up a little.
Sometimes you gotta hear things more than once.
Right. 21 days to form a habit, so we'll just do this. Thank you guys. Have a good rest of your day. Part of the reason why I'm so passionate and enjoy being a partner with Alina and their patient experience, it's why everyone's here. I love that Alina focuses on quality, and I love that I get to be a part of, through this patient and family advisory council, helping them improve quality, helping to improve the patient experience, and love doing that.
I was in my residency training, and there was a patient with ovarian cancer. So we had her on the operating room table, and she was holding my hand as she was going to sleep, and she whispered, "Don't let them do this to me." And we did, and she never spoke any other words again. It's not what she would have chosen. She would have rather not had the procedure at all and been able to say goodbye in a respectful way, in a way that honored the relationship with her and her daughter, rather than being on the operating room table. It made a huge impression on me. What kind of conversations are we having with people so that we adhere to their wishes and don't just think that we know what is best for them in their given circumstance? So I'd say experiences like that tell me that, we really have to take the voice of the patient and the voice of their families into things to understand what's really most meaningful and most impactful.
Take a motion.
If you want to improve a system, you have to measure it. And if you're going to measure it, you have to know what you're going to measure. So those data points that really differentiate good care from mediocre care is what we focus on.
A big change now between the 1990s and a game changer is that we have data information in ways that we've never ever had it before. And if we tie that together and get a whole picture of somebody's care, we'll be able to provide them much better care and focus our resources on how do we support them in the best possible way.
We're taking a look in our service lines at what measures we want to focus on, whether that be length of time in the emergency room or outcomes in surgery for patients for breast cancer, to be able to get physicians used to the fact that we're going to be measured less on the number of things we do and more on the quality of the things we do is preparing us for that future.
Where we're at is we really need to be great stewards of these rich resources that society has entrusted us with. And I'm not positive we've been as good a stewards of those resources as we should be.
My name is Amy Edwards. I'm a nurse by background. I've always worked in oncology. My title is Director of Clinical Integration for the Virginia Piper Cancer Institute at Allina Health. One of the big things that came out of our patient and family advisory councils at Allina was the healthcare system is way too complicated. And so out of that actually came the development of the Cancer Care Coordination Program, which I have the profound honor of helping to lead at Allina Health.
The integral part to that is the Cancer Care Coordinator that is sort of tying everything together. So they are helping me and helping the patient make sure that all of these appointments, these imaging tests, the surgery, everything is scheduled appropriately, that nothing slips through the cracks. They always have somebody to call if they have any question, no matter how insignificant they might think it is, and always can get their answer.
So the Breast Program Committee looked at 31 different quality measures. A number of them, there was a lot of variation. When we asked our patient advisory council, they said that's not acceptable. We shouldn't be accepting that an appointment takes a couple weeks to get to have a diagnosis when you're told you have an abnormal mammogram. Those are basically sleepless nights.
Amy has a tremendous amount of experience and tremendous knowledge caring for cancer patients, but it's different when you're the patient yourself. And so I try to talk to her as though she didn't have this tremendous nursing background that she does have, but it also is very helpful because I can go into a much more nuanced conversation with her than I could have with somebody who doesn't have that cancer background. So it's really a balance. You want to respect her knowledge base, but you don't want to take for granted that she knows something that she might not know.
Through the Allina Breast Committee and being part of that since its inception has been an amazing experience. We have collected so much data in that committee and shown how that data is so incredibly powerful to help us change how we do things. And through the data that we've identified and that we've collected, we've been able to show physicians differences in practices. So we've had physicians who, once they see where they are on the scheme of things, they quickly change and be conforming with what the national guidelines are for best practices. So that's been really exciting.
We, on a daily level, use quality and data to improve the delivery of healthcare. It has transformed the way we deliver cancer care, it's transformed the way we interact with payers, and it's transformed the way we have created a narrative across community health, end-of-life care, and really the true continuum of care.
Patients are entrusting us with a very intimate part of who they are, and something we have to respect very dearly, and not forgetting that each of those is an individual that has loved ones that are worried about them is what makes this a special way to spend a life.
We want somebody to never feel left alone in that journey, whether or not they're within the walls of our hospitals or our clinics. We really want those loving arms around them wherever they live so we can support them and their families through difficult times and ones that are much more hopeful. To change hearts and minds, you have to be, first of all, a deep listener and curious about things and curious about the way things work and don't, and listen to the people who are closest to the care and the processes of care and the people who are experiencing them, and listen to our patients' voices to understand what needs to be changed. The more you care for the individuals in front of you, the community that surrounds you, and with people who share that same caring mission, what better labor of love is there than that?